Hailed as V-Day, the first person in Northern Ireland to be vaccinated against COVID-19 was 28-year-old Joanna Sloan. She's a nurse from Dundrum. She's the sister in charge of the COVID-19 vaccination programme here at Belfast's Royal Victoria Hospital, and she's engaged. Her wedding was postponed amid the pandemic, but now perhaps she can look to the future with some optimism.
Our health correspondent Tara McLaughlin is here with us now. So what do we know about the current infection rate in Northern Ireland? What's the situation inside our hospitals? And indeed, the question I suppose we all want to know now as to whether or not we're going to get out of this come March is lockdown in Northern Ireland working?
Yes, good afternoon. Well, it very much does seem to be going in the right direction and infection rates are down. It appears that the lockdown is working. Sometimes during the peak of this, we were seeing infection rates up in 1,500, some days over 2,000 new cases of the virus being confirmed. But recently, obviously, in the newsroom, we keep an eye on it every single day, and every day we tweet the COVID stats. And we have been seeing a significant decrease, sort of averaging in and around 500 new cases per day now, whereas in the past that had been over 1,000, in some cases over 2,000. And we did hear that confirmed from the Chief Medical Officer yesterday. You spoke there, Stuart, about the health briefing, which I set over every week, and Dr. Michael McBride was there yesterday to confirm what we had thought, that the lockdown is working. The R rate is coming down. It's below 1. This is the R rate for transmission of the virus. Of course, don't forget the R rate with hospital admissions and transmissions of the virus are two separate entities. They record differently. So it's between 0.68 and 0.85, it's estimated at the moment. But the overall objective of the lockdown was to get the R rate below 1. So it does seem that it's working.
1 year on from the first positive COVID case in Northern Ireland, how is our health service coping and what does the future look like? Well, downtown Cool FM were given exclusive access to Daisy-Hill Hospital here in Newry, and staff here have quite a unique story to tell.
The emergency department here has been a talking point in the community for some time now. It temporarily closed back in March when COVID first hit as part of the Southern Trust's response to the pandemic. Staff were transferred to Craigavon Hospital to run a non-respiratory A&E, effectively merging all emergency care in the Southern Trust onto one site. All COVID patients were treated at Craigavon and non-COVID sent back to Daisy-Hill. The idea was to keep it COVID-free. Concerns were raised in the community about access to emergency care, and in October, Daisy-Hill became the only emergency department in the UK to reopen just months after it closed, at a time when COVID transmission rates in the community were very high. Now, it's a small hospital site with limited space, so it was a huge effort given all the new social distancing requirements. Extensive structural and estate work went into it. Some patients who spoke to me but didn't want to appear on camera said staff have moved mountains to get this ED up and running again. Well, we were welcomed into the hospital and heard from the man tasked with the restructuring, Clinical Director Gareth Hampton. But first we headed to the donning room where staff put on their PPE as part of infection control measures. I was shown how to correctly don a mask and visor, continuously hand sanitising throughout. Staff told me they've sanitised at least 5 times before they've even started their shift. And then it was on to the emergency department to hear some of the challenges of reopening amid a global pandemic.
Well, the emergency department is usually a patient's first point of call when they're accessing a hospital. But of course, it has changed since COVID hit. Dr. Gareth Hampton talked me through the patient journey.
The patients we suspected of COVID, we would put in areas together, and some of those have walls, but then it's just so difficult to keep people completely separate. Our emergency departments, many of them were built many years ago, and they're just not designed to have a respiratory pandemic. It's very difficult.
Rapid testing was introduced in all emergency departments in January this year. It means staff can tell within 12 minutes if a patient is COVID positive or negative. The Lumiere test is quick and easy to use, and staff talked us through how it works. Gareth said it's been a game changer, and many asymptomatic patients are surprised to hear they have the virus when they visit A&E with a head injury, for example.
Many patients who had breathing problems didn't have COVID, and many patients with other problems did have COVID. It's totally changed how we work. We're now able to tell within 15-20 minutes from people arriving if they've COVID or not. and we can put them in different areas. It's so much safer for the patients and for staff.
Elsewhere in the hospital, we were keen to hear how staff were coping in the COVID wards after a relentless year of the pandemic. Frontline nurse Natalie McCann, who's been redeployed from surgical and is now a ward sister, shared a very honest account of her new daily reality.
That's the guidelines that we've got from infection control, is that in any area where we're wearing the red PPE, which is in all the COVID wards, because the family members aren't fit tested to the right masks, it's only you can come in for 1 hour at the end of life, just one person for 1 hour, which is heartbreaking for a family that might not have seen, for example, if their family member was in a nursing home and the nursing homes haven't allowed visiting, they might not have seen them for months before that, and now we're telling them, well, one person can come in for an hour and that's it, and then I don't know how people can cope with it. I know the staff have been very, very distressed over it, myself included. Like, you just want to know that that person has somebody there, and we obviously try our best. We try and stay with patients as much as we can and make sure they have someone there in the last hours and minutes of their life. But it's very upsetting. The only way I can sum it up is everybody is trying their best. That's all we can do at the minute. I worry for the mental state of a lot of my colleagues and a lot of the colleagues in the other wards. Like, we do have great support. The trust has brought in staff support services, but there is only so much you can see every day before it takes a toll, and yeah, I'm just worried for the future.
So what does the future hold for this hospital? Shauna Grant is a community representative on the Daisy Hill Hospital Pathfinder group.
Other hospitals had reduced ED capacity to cope with COVID-19 and hospitals were designated as certain COVID hospitals. Because previously we have had such community alarm about potentially reducing the hours of the ED up 3 years ago, which was a hugely fraught issue within the community. Thankfully we were able to resolve the concerns coming from there, and that we have been able to recalibrate everything in now that we've got not used to COVID-19 but much more understanding of how to deal with it. The ED has reopened, and we've been able to reassure people that that's on a permanent basis as well.
Yeah, I suppose when you put it in context, I mean, really what he is saying is that it is going to be 2022 before we can expect to live without any restrictions, and that in terms of, if you use the analogy of like a sports car, you know, if putting your foot on that pedal in terms of easing restrictions and then putting them back on again full force, you know, and this is a seasonal virus. In terms of the summer, things will be lifted. You know, it might feel like last summer, is what he said. Now, he didn't mention summer holidays or international travel, because we know that's all yet to be clarified, and we're expecting an update from our executive next week in terms of the current restrictions, and also from Boris Johnson on the 22nd. He's outlining a path out of lockdown.
The COVID-19 vaccination programme has now been extended to include the over 50s in Northern Ireland. But just last night, the Republic of Ireland became the latest countries to suspend the use of the Oxford AstraZeneca vaccine amid fears of blood clotting. Now, the World Health Organization has said there is no evidence that it is linked, and our Health Minister Robin Swann quickly moved to allay some of those fears. In a statement, he said that he had consulted and that Northern Ireland would continue with the use of the Oxford AstraZeneca vaccine. Now, this morning here at the Ulster Hospital at the vaccination site, the Chief Medical Officer, Dr. Michael McBride, got his vaccine. He told us he would do it again.
I didn't need to be called a second time this morning when the opportunity was to get my vaccine. The MHRA is looking at all of the data. We have a small number of individual case reports of concerns, but the MHRA is very clear that they do not feel that those are linked to the vaccine and are probably random events which are occurring and would have occurred normally. But as I say, what the public should be assured of is that the MHRA is a global leader in safety and efficacy of vaccine and is publishing data on side effects on a weekly basis.
And we are expecting an update on outdoor sports and schools from the executive this week. We asked Dr. McBride what his thoughts were.
Well, I'll be providing advice to the executive. The executive will be meeting tomorrow, and those are rightly matters for all ministers around the executive table to consider. But we do know that many of the activities that are carried out outdoors, such as meeting up, outdoor sport carry less risk. No, not zero risk because of the activities around that. What is really, really important is if the executive decides that it's time to make progress in those areas, that things like car sharing, those are the risks, sharing changing rooms, sharing common areas, those are the risks associated with that sort of activity. And we just need to be very, very careful. This virus hasn't gone away, it's not going to go away, and we need to adapt our lives to living with it.